All right, this will be a short talk on knee MRI anatomy. So we're looking here primarily at the femur and tibia. You can see the joint lines. We're looking primarily at ligamentous injuries, muscle tendon injuries, meniscus components in these views. So if we were to take a cut right through the middle here of the knee, you can see the femur, the tibia. You can see the fat pad here, the patella, patellar tendon. You can actually see this would be where your ACL would come off of and correspond to, along with your gastroc and soleus muscles down in here. So kind of get an idea of what you're looking at there. And then a little more detail here as we go a little closer to the middle. So you see your femur, your quad tendon, patellar tendon, fat pad underneath, your gastroc here, and different of the calf muscles here as they form behind the tibia. And then if you go out further outside here, you can actually see your vastus medialis. We're looking at the MCL here. So you can kind of see the sartorius and things coming in to form your pes anserine bursa. And then if you were to go a little further in there, you see the medial-femoral condyle. This would be more of your first cut here. You can see these different slices of the anatomy here. So you see your tibia and gastroc and semitendinosus muscle here. So you can kind of get an idea of what you'd be looking at with the knee here. And then if we're to look at this cut going through the knee, you can actually see your condyles. You can look through here, see your vastus medialis, vastus lateralis, sartorius. So you can kind of see your posterior tib, or perineal longus. So you can kind of see all your different muscles here forming. Here's a good one for your ACL, and then there's your PCL that's going to be going behind it if we were to change that cut. If we're to do these cuts here, so you can kind of see the vastus medialis here, your gastroc heads, and kind of looking through your femur here, you can kind of see your veins here and your popliteal artery, popliteal vein there. So you can kind of see vastus lateralis out here. So you can kind of see all your stuff here. You see your quad tendon, because we're up here above the patella. And then if you look at the second cut here down below, you can actually see the patella and how it sits in there, and start thinking about your muscles here that you would see here. So be able to look at this anatomy a little more in detail in your anatomy books. And here's cuts a little further down, closer to the end here, where you can see your PCL, your ACL, your calf muscles here are all abbreviated there. So you can see the inferior portion of the patella. And then as we get further down into the fat pad here, you see the tendon, fat pad. You see your collateral ligaments and part of your calf muscles here. So be able to look at those. You can see your ACL in the middle there. Be able to look at these in a cross-sectional way to review this for your anatomy as we look at pathology in the knee on the MRI and the clinical cases during lecture.